Well, hello, welcome to Hudson Health. My name is Dr. E.J. Akanyele. I am Chief Medical Officer of Jersey City Medical Center, a facility of RWJ Barnabas Health. Today, we're very excited to talk about something that you may not have thought about, thankfully, but palliative care. Palliative care is a highly specialized field of medicine that deals with patients and families facing serious illness. Now, you may not know somebody who's had the opportunity to use the services, but we wanted to engage you and this community on the importance of this service, especially with our patients and our aging population. Palliative care is very different from hospice care, and we're going to talk all about it today. With me, joining me in studio today, will be Dr. Michelle Reisner, one of my all-time favorite people, and a certified palliative care physician and geriatrician and chief of palliative care at Jersey City Medical Center. So I'm looking forward to these discussions. Please stay tuned.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJ Barnabas Health. Let's be healthy together.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights. Your one-stop store for residential and commercial floor treatments. Carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants. All major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome back to Hudson Health. My name is Dr. E.J. Akanyele. I am Chief Medical Officer of Jersey City Medical Center, a facility of RWJ Barnabas Health. So do you know what palliative care is? Many of you may not know. Some people may think palliative care is the same as hospice care and the same as end-of-life care. They're actually very different. Now, in medicine, as we think of the best approaches for a patient, especially in the ever-growing complex medical system, with many of our patients living much longer than we've ever had in human history, we're beginning to think of multiple ways to take care of patients, and palliative care is one of them. It is a very specialized and complex healthcare enterprise that takes care of not just patients, but their families at the end of life. It provides comfort, support, and wraparound services for patients and their loved ones as they navigate very serious illness, such as cancer, but also heart failure or COPD. So today we're really excited to delve into this. We're going to talk about the importance of palliative care. Who benefits from palliative care? I can tell you in my years of preclinical practice, it's not just the patients, it's also their families. We also want to talk about the emotional, physical, and spiritual support that palliative care doctors provide day in and day out. We at Jersey City Medical Center have a very strong palliative care program. And in fact, Dr. Michelle Reisner, who runs that program at Jersey City, is going to be my guest. She's going to be telling us about ongoing advances in palliative care, how this field has grown, evolved and continues to take care of the community. We're also going to learn about the role of caregivers, right? What can caregivers do in this circumstance to support their loved ones through this journey? There is also an integration of patient wishes. Now more than ever before, we want to make sure that the patient is at the center of our decision making. And this is all across medicine, really, not just in palliative care. So I am extremely excited. I think it's going to be a great episode. I am going to ask her about the history of palliative care, the role of communication, how it's different from hospice medicine, all the facets of care that we have in our healthcare system, and how you at home in the community who may have an aging parent, a loved one battling a chronic disease, can best access all the resources we have. As always, we're very engaged in how everybody in a society, even the most vulnerable, or people who may not know that they have access to a healthcare system, can come within and be a part of the work we do. We'll be right back.
Comprehensive healthcare is here, here, and here. RWJ Barnabas Health is healing, enhancing, and investing in Hudson County with its 2 newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Panapinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panapintodevelopment.com. Panapinto Properties, building Jersey City for everyone.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Welcome back to Hudson Health. My name is Dr. E.J. Akanyuli. I am Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. Today, I have the unique opportunity to talk with Dr. Michelle Reisner, Chief of Palliative Care at Jersey City Medical Center. Welcome, Dr. Reisner.
Thank you. Happy to be here.
Of course. Please start by telling the audience about yourself. How did you become a palliative care doctor? That's a good story I've heard.
Well, I don't know if it's a good story, but everybody who does palliative care has a story. This is not an easy field, and everyone in palliative care and hospice usually has a story. And usually they're the most interesting people that I know, and I've had teams for many, many years. How I became a palliative care doctor is that it was this time of the year, probably in 2015, I go back, way back, 20 years ago, and one of my residents unfortunately had breast cancer. It was before even palliative care had started as an official ABIM subspecialty. And she had breast cancer, and she wanted to live just to see her son graduate high school. And she died a terrible death. She was in the hospital. She was getting chemo up until the last minute. She was in horrible pain. She never got to see her son's graduation. She wanted to go to the son's graduation, and the family wanted her to stay in the hospital and get chemo. And I realized at that time that there has to be a better way of dealing with end of life. I just didn't know how to. She had asked me to be her attending physician, which I was grateful and privileged to be, but I remember her so fondly, and I remember how she suffered, and I remember she had a really bad death. And since then, I decided to pursue palliative care, which is sort of between curative and end-of-life care. And at the time, it was really just a very new subspecialty, hadn't even been recognized by ABIM, which was only done in 2015, actually. But I decided that there has to be a better way. And so that's sort of been my story, why I've always wanted to have patients who feel that unfortunately, if they have a serious illness, they're heard, their needs are known. And in my opinion, most people just sort of, if they are going to die, want to die at home without any pain, surrounded by loved ones, and not necessarily intubated, restrained, peg tubes in an ICU. And so that's sort of been my journey into palliative care.
What a sad story, but that out of that came an entire career.
Correct.
Now, you alluded to this a little bit, end of life care. So what's the difference between palliative care and hospice care? Can you tell us?
So yes, so patients who have a serious illness need as much support as they could give. At any age or at any stage of the illness, they need to have support. And so what was happening up until this subspecialty of palliative care is patients would get curative treatment, and then at the last minute, they would perhaps be put on hospice. There was no transition between curative treatment and hospice. So it was cure, hospice for a few days, and palliative care is that bridge between somebody diagnosed with a serious illness and hospice care. So both subspecialties or both specialties aim at relieving symptoms, making sure families understand what's going on, communication. But the palliative care can be given in conjunction with curative treatment, whereas hospice care, we usually say a person has 6 months or less to live. We think they have 6 months or less to live, and that's when we start putting them onto hospice care.
That's a very good point of differentiation. And just for our viewers, what you are saying is that palliative care can be used in conjunction with active cancer treatment or active treatment for many modalities, correct?
That's the goal of palliative care. We want to work in concert with patients who are receiving curative treatment and help them through this journey. It was a struggle in the beginning to try and convince the previous CMO that we needed a team of people to help patients diagnosed with a serious illness. And then I believe, and there were about 3,500 physicians in 2010 who would sort of practice in palliative care, and the field has grown enormously. But it was really a struggle until there was a landmark article in the New England Journal, August 2010, which showed that patients who had metastatic small cell cancer who received usual treatment and those who received usual treatment and palliative care lived longer, at least by 2 months, had better end-of-life preferences and a better quality of life. And so that was sort of the beginning of this great explosion of palliative care into, it's acceptable now that most hospitals, all hospitals with over 300 beds, 98% of them have a palliative care team.
And we're thrilled to have an excellent palliative care team at Jersey City Medical Center and expanding, correct?
Very much so,
Can you
much
tell
needed.
us a little bit about
I think we need to understand that the elderly population is growing. Remember, by 2030, there's going to be more people over the age of 65 than under the age of 18. So elderly population is growing, which is great. However, there's a 10% of that elderly population consuming 60% of healthcare resources. And so the need for palliative care is just, it's booming. And right now there are about 19,800 palliative care doctors, nurse practitioners who play a huge role in palliative care. They're just a pillar. So that means that for every 100,000 patients, there's about 2.81 palliative care physicians, never enough. Mm-hmm. And so all doctors really have to embrace palliative care and be part of this journey.
That's fantastic. Now, I know you've talked about this a little bit, but very briefly, who is eligible for palliative care?
So anybody with a serious illness at any age and at any stage. Obviously, when somebody is diagnosed with a serious illness, people who are living a normal life suddenly are diagnosed with a serious illness. This becomes an extremely difficult chapter in their life, whether it's that they're going to be cured or whether they have to now start thinking of their what ifs. And so, palliative care is for anybody who sort of is diagnosed with a serious illness at any age or at any stage of their illness. Palliative care is available.
That's great.
Just to also say, palliative care is not only in hospitals. There's a growing need for palliative care in nursing homes, in the home. During COVID, we did a lot of palliative care using telehealth. because we couldn't get into the hospital, so family meetings would be by telehealth. A number of rural hospitals don't necessarily have palliative care, and so telehealth palliative care has become very useful in those settings.
We'll hold that thought. We'll be right back.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJ Barnabas Health. Let's be healthy together.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net. Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome back to Hudson Health. My name is Dr. E.J. Acunielli. I'm Chief Medical Officer, Jersey City Medical Center, facility of RWJ Barnabas Health. I'm back with my wonderful guest, Dr. Michelle Reisner, Chief of Palliative Care, Jersey City. Welcome back. So, Dr. Reisner, we left off talking about multiple things, but I did want to ask you about how a family, right, a loved one is diagnosed or given a healthcare diagnosis of a serious illness. How does a family support the patient through A, this diagnosis, and B, the journey of palliative care?
I'm asked that question a lot.
Oh,
so somebody is diagnosed with a serious illness and their loved one will come to me and say, what can I do? And so I like to break it down into three different sort of aspects. I tell wives or children, let's break it down into the emotional, let's break it down into the physical and the practical, and let's break it down into the advocacy and the communication. So starting with the emotional, I think this is a very tough time for patients. And I think what you need to understand is I tell whoever is the loved one, be present. When you visit somebody, when you're there, just be present. You don't have to give your opinions. Just hold their hand. Even if they don't want to talk, it's fine. Just be present, which is very difficult. Be off your cell phone. Be present. Know that they're there with you. You're there for them. I think you need to also sort of understand that this is difficult for them. You need to validate their feelings. You may not agree with their decisions, but you need to validate their feelings and make sure that they, that you understand that what they want is what their wishes. It's not your wishes, it's their wishes. And so you really have to open up communication, let them talk, let them tell you what it is that they want. They have fear, they have grief, they have anger, they have the what ifs. So many emotions are going through. Just be there in open communications. From a physical and a sort of practical point of view, I like to say that you need to really try and see, how can I help? You know, you forget how much needs to be taken care of daily. Can you help them bathe? Can you help them wash? Can you collect their mail? Can you do some shopping? Can you bring them dinners? Your friend's going through chemo. Arrange for all our friends to deliver dinner every night. So sort of be there sort of from a practical point of view. Try to create a peaceful environment. And peaceful, I mean, there may be siblings that are squabbling. Let it go. You need to have a peaceful environment, sometimes light music, bringing in some photos, scents help, something like lavender. Just make sure that there's a peaceful environment, really does help that person. And from an advocacy point of view, you really want to understand what it is that the patient wants. What is it that you want? Make sure that the healthcare team is aware of what they want, be their advocate, validate them, And at the same time, you need to understand their illness. Maybe you want to look it up, see what's going on, join a support group. And most important, I think, is that healthcare, the healthcare team knows what the patient wants. More importantly, the loved ones and families still take care of themselves. Self-care is really important, and I see this all the time. The wives are so busy with their husband's illness or vice versa, they forget to take care of themselves. And self-care is always very important.
That's really good. Just take care of yourself, take care of your loved one, be present, and make it peaceful for them, and really understand that they're going through a lot.
And also try to see how you can help. What can I do? Can I get your mail? We have a patient a week ago who, her biggest fear, she wanted to go home because she had 3 cats that wouldn't be fed. With no children, no support. So she just wanted to leave because her cats were not being fed. So we're talking about really simple things that people don't realize, but see, how can I help? That's so important. And again, be present, I think, is so important. Don't judge, just whatever, listen. Hard to listen, but listen.
Got it. So a lot of psychosocial support.
A lot of psychosocial support.
So you mentioned communication, which is really important, not just communication within the family, but with the healthcare team. As we both know, healthcare is really complex and there are multiple physicians and appointments. How does communication play a role in both palliative care and through this difficult journey for most families?
I think communication is probably the most important tool that we have in palliative care. I think good communication makes a patient who is feeling overwhelmed and uncertain, makes him feel empowered. So the role of the palliative care doctor, by and large, is a lot of communication. We certainly want to make sure that their physical symptoms are being managed by speaking to the patient and the healthcare team. We have a lot of tools to help patients who may have pain. Pain is a terrible thing. We know how to treat pain. We treat pain all the time. Shortness of breath, nausea, vomiting. If they're going through chemo, we know how to treat that. So physical symptoms are important to understand what is it that the patient's feeling. Certainly emotional health. Patients are, as I said, feeling anger, grief, stress. So emotional health is really important. We have to listen to them as well as the palliative care doctors. I think we want to communicate in advocacy again, understand, try and get we have patients who perhaps have siblings who are fighting with each other. So we really become the advocate. We need family meetings where everybody needs to understand what everybody else has. We have a lot of family meetings, which is part of palliative care, which is all about communication. And certainly good communication builds trust and reassurance, and certainly allows for dignity, clarity, and support while a patient is going through this very difficult journey. So nothing more important than communication in palliative care.
That's so well put. On that note, Dr. Reisner, it's been an absolute pleasure having you. I mean, you've really been instrumental in our program at Jersey City. Under your leadership, it continues to grow to serve our community. It was wonderful having you today on Hudson Health to educate our community. Thank you.
Thank you.
Comprehensive healthcare is here, here, and here. RWJ Barnabas Health is healing, enhancing, and investing in Hudson County with its 2 newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just 1 pass stop away, or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Panepinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panepintodevelopment.com. Panepinto Properties, building Jersey City for everyone.
Welcome back to Hudson Health. My name is Dr. E.J. Akanyili. I'm Chief Medical Officer, Jersey City Medical Center, a facility of RWJ Barnabas Health. I had the tremendous opportunity to speak to Dr. Michelle Reisner, palliative care doctor, and also Chief of Palliative Care, Jersey City Medical Center. What a pleasure it was to interview somebody so knowledgeable about a movement that has now become very mainstream, and that many years ago, people like Dr. Reisner were the pioneers of such an important movement in medicine. She tells the moving story of really becoming a palliative care doc because one of her residents had a serious illness and later succumbed and wanted her to be part of that transition. Something else we discussed and I wanted to highlight was the difference between hospice and palliative care. So palliative care bridges the gap between curative care and end-of-life care, which means, and many people did not know this, that palliative care can actually occur with ongoing medical treatment, and that's the goal. We spent quite a bit of time talking about supporting families, the psychosocial support that is needed when a loved one is diagnosed with a major illness. And I did try and get Dr. Reisner's suggestions around that. The first is just be present for your loved ones. And second is, to the best of your ability, to try and take away some of those day-to-day tasks that could complicate life and, make them not recover fully if they're worried about their pets, a dinner, running errands, etc. And the last is the communication aspect. Communication is key, communication among different family members, but also communication with the medical team. Support is especially important, and as many people who've had a loved one, as I have as well, who's gone through this understands that that person is, as Dr. Reisner mentioned, is going through multiple stages and multiple emotions, and to be present without judgment is very important. Now, I think part of what we talked about and it's been highlighted, and I've seen in my time in Jersey City, is that there are lots of myths about palliative care, who is eligible for palliative care, and many people really think it's end of life. And going back to that definition, it's really for anyone who needs support. We've been thrilled with Dr. Reisner's leadership and the team of palliative care specialists that we've gotten together at Jersey City Medical Center. And we hope that this community can continue to use this resource, as with all our resources at different stages of their lives. Thank you for coming and watching Hudson Health.